welcome to New Look Guide. Today we will talk about obesity and weight loss. One of the best surgeon, Dr. Babek Tabandeh, is with us. So he will answer the frequently asked questions of the patients about obesity and weight loss. This is so important and very crucial. So I would like to thank him taking his time with us. So thank you, doctor.
You're welcome. Nice to meet you.
Nice to meet you too. And can you please explain about yourself a little bit? So we would like to know about more you.
Sure. I'm a general surgeon. I'm dealing with bariatric surgery mostly. I started my faculty of medicine in Turkey in 1986, and after that I finished the faculty in 92. I finished my residentship in general surgery in 98, and after that I started to work as a general surgeon. In 2004 I started with bariatric surgery. At that time we used to do lots of laparoscopic gastric banding and less gastric bypasses, but after 2008 we shift more toward the sleeve gastrectomy and bypass together. After that, with the concept of the bariatric and metabolic surgery, we started to deal with lots of patients with hyperlipidemia, diabetes type 2, and patients who had some metabolic problems. So since that time, we do lots of surgeries like sleeve gastrectomies, revisional surgeries, different types of gastric bypasses like one anastomosis bypasses, proximal and distal, Roux-en-Y gastric bypasses, and duodenal switch as well. We do almost all of these operations with laparoscopic surgery, and in some patients we use the robot because we have that facility to use the robot in our hospital.
Okay, perfect. So doctor, today I have some lists of questions, so I would like to ask them to you. These are the frequently asked questions of the patients. They wondered about them. So first of all, what is obesity?
Okay, the problem of having lots of fat accumulated inside our body is called obesity. So my weight might be high and I may have lots of muscle, so I'm not obese. Mm-hmm. To being obese, I have to have lots of fat inside our body, and there are different technologies that can show that lots of fat inside the body, but one of the easiest ones is to calculate the body mass index, which is the ratio between our weight and height. Height in centimeter with square and weight in kilogram, and there are lots of formulas that you can find them from the internet, and you just put your weight and height even with pounds or inches and so on, and it can calculate this for you. Normal body mass index, BMI, must be between 19 and 25. If we are over 25, it means that we are overweight. Okay. If we are over 30, then it is obesity. And obesity, if is complicated with some problems like diabetes or hyperlipidemia or lots of problems, we are going to call it as morbid obesity. So at this time, it is not only excess weight, it is going to be accepted as a disease. Okay. If the BMI is over 40, even if I don't have concomitant problems or complications of obesity, it is still accepted as morbid obesity or a disease.
Okay, also morbid obesity is one of the wondered questions, okay. And it was my list, so now we know about it. So what are the health risks related to obesity?
Okay, having excess weight because of excess fat is not only the elevation in my weight, is not only the shape that is going to be not desired, but that excess fat is going to act as a biochemistry lab inside my body, and it's going to change lots of chemistry and chemical problems, lots of hormones, and these can make a lot of problems. So if I have the obesity, first of all, I have some issues with my chemistry inside my body. For example, the most frequent one is the type 2 diabetes.
Okay.
One of them is hyperlipidemia. I may have some problem with uric acid and may have the gut disease, and these are the problems with the joints, something like rheumatism. Other than that, I may have some problem with the hormones, and all of these hormones can cause problems with reproductivity and problems with sex hormones and things like that, in both genders. I may have some problem with chemicals inside my body that can cause inflammation, and inflammation is the hyperactivity of my cells inside my body. These can end with some connective tissue problems. These can end with some rheumatismal problems, and unfortunately these can end with cancer. So this is another problem. And the physical problem with that excess weight may cause lots of pressure over my body and cause some joint problems on my ankle, on my knees, on my hip, problems with my back, or even some problems like varices, varicose veins inside the legs, or gastroesophageal reflux disease, which is one of the most common problems in the obese population.
Okay, thank you, doctor. These are so important. So who are the candidates for bariatric surgery?
Okay, all of the people who have morbid obesity, it means that their BMI is over 35 with some problems, or over 40, or people who have BMI over 30 with uncontrolled diabetes are good candidates for surgery. It does not mean that we do surgery on all of these patients, but these patients, if cannot have response with medical therapies or exercises or diets, or they have tried them a couple of times and failed, then yes, these patients are good candidates for surgery.
Okay, so this is also a very good question. Are weight loss surgery and liposuction is same?
Okay.
This is very important. Many patients are
Yeah,
asking.
to me it's important also. Our aim of doing this bariatric and metabolic surgery is giving the patient back his health.
Yes.
So we accept this obesity as a disease that is pandemic. It's just like COVID-19 all over the world. We have lots of that, and the WHO accept that as a disease. So we have to treat it, and when we treat it, we know that we lengthen the life expectancy of the patient. We reduce the amount of all of those complications that are related to the obesity. Liposuction, lipolysis, fat removal, or all of those surgeries are very, very valuable procedures, are very have good outcome surgeries, but for shape, not for health.
Body contouring.
Yes. So if you don't like your breasts, if you don't like your hips, if you don't like your stomach, you can go and do these operations. But these have nothing to do with the treatment of the obesity, because the main health problem with obesity is the excess fat inside your body, not under your skin. So we need to do some change to affect our metabolism, to accessing the health after these operations.
And how effective is weight loss surgery? How much weight can one lose immediately post-surgery?
Okay, after the surgery, the goal is to reduce about 75% of our excess weight during the first 12 to 18 months after surgery. It means that if it is not important what my weight is, it is important what my excess weight is. So my ideal weight is, for example, 80 kilos, but I'm 120. So my excess weight is 40 kilos.
Yeah.
And the aim is to just get rid of the at least 75% of that, which is 30 kilos, during the first year or first 1.5 years after operation.
Okay, and if we decide to come to have this surgery, how many days we need to stay in Istanbul and in the hospital? Can you please give us an idea about that?
Routinely, we do all of those pre-operative management tests and all of those measures and whatever, endoscopy, ultrasonography, or consultation with chest man and cardiologist and so on in one day. If the patient have some serious health issues, then we prefer to be in contact before they come and just try to understand what their problem is. And sometimes it may take the second day. But normally in one day we resolve all of those questions, and the second day we can go to the operating room. After operation, in average we try to have our patients between 2 to 3 days in hospital, and in the second or third post-operative day we discharge them. 2 or 3 days after discharge they will be able to fly back home.
Okay, and what will be the diets after weight loss surgery? How they gonna continue their life?
Okay, the most important thing to me before starting to do the operative procedure is my patient to understand what he or she is going through that. After operation, the satiety is going to change, the hunger is going to change, even the willing to consumption of alcohol or water or cigarette smoking is going to change. So these are all changes between my hormones and my nerves and senses and brain and my soul. If the patient conduct them in a good way, then the performance is going to be very high. But at the end of the day, the fact is that after bariatric surgery, I'm going to feel full with just a little amount of food. So this little amount of food has to be with a high quality. If I just going to consume some sugar, then I'm going to have the vitamin insufficiency and mineral insufficiency and protein insufficiency, and then I'm going to have some health issues. But patients who have a very good education about how to eat and how to act and how to prepare their food, then with those little amount of eggs or fat or meat or so on, are going to stay healthy. The early post-operative period, something about 2 weeks, is the period that they are going to have only liquids. But at the end of the second week, they can eat normal.
Okay, so they take this training from you and the dietitian,
yes.
I think, yeah? Okay. So this will be my final question for today. So the types of the surgeries, this is also highly important for the patients. We have gastric sleeve, gastric bypass, mini bypass. What are the differences and who are the good candidates for those surgeries?
Okay, actually we have to have a big session for that with you, but
very small information.
Yeah, but in a couple of words, it is not important actually what type of surgery is going to be done on patients. With all of those pre-operative tests, we decide what surgeries are not good for that patient. So there, for example, if I had a bad hiatal hernia and gastroesophageal reflux and reflux of all of my acid to my esophagus, then sleeve gastrectomy is not a good candidate for me. If I had a old diabetes and bad levels of sugar, then gastric bypass or distal bypass or even duodenal switch are going to be better chances for me. I may have a very high degree of obesity. For example, my BMI might be around 55. So these are super obese patients, and we may decide to do a double seance surgery. So first do the sleeve gastrectomy and wait for 1 year, and then with little less hazards, then we are going to do the second part as a, for example, mini bypass or duodenal switch or things like that. So it is important to explain to our patients that this is the best situation for you, and these are the things that are going to change for you. For example, don't take soda after surgery, or don't take sugar after surgery, or do this and this after surgery.
Okay, doctor. Thank you very much
You're
for
welcome.
taking your time with us.
Pleasure.
These were so important questions for the patients, and it will really help us. Thank you.
Yep.